HIV infection rates and treatment. Infection rates, according to the CDC, include 36,400 new HIV cases in 2018. 7,600, or 21% of those, were among those aged 13 to 24, with the most diagnoses among young gay and bisexual men. From 2014 until 2018, diagnoses decreased by 15% among teenagers and young adults. According to the Georgia Department of Public Health, there were 2,504 people diagnosed with HIV in 2019. This is a rate of 28.4 per 100,000 residents aged 13 years and older. Habersham County had less than 5 new cases and a rate of 75 people living with HIV. This is a rate of 165.5 residents per 100,000. Stevens County had less than 5 new diagnoses. They have 46 people living with HIV and a rate of 177.4. Hall County had less than 5 new diagnoses, 48 people living with HIV, and a rate of 183.2. Medication and treatment and testing. There are 3 types of tests available to test for HIV using blood, oral fluid, or urine. The first is a nucleic acid test that uses blood drawn from a vein to detect the virus in the blood. This test can determine the person's viral load or how much virus is present in the blood. Even though HIV detection is sooner than with other tests, it is rarely used due to the fact that it is very expensive. 10 to 33 days after exposure is how long it takes to get a positive test. The second type of test is an antigen antibody test, and it's used to determine if HIV antibodies and antigens are present. Even before antibodies have developed, an antigen called P24 is produced by the body. The test uses blood drawn from a vein, but a rapid test is available that uses blood from a finger prick. These tests are common in the U.S. HIV antibody tests are the third type. They look for antibodies in blood or oral fluid. Blood drawn from a vein detects HIV infection quicker than finger sticks or body fluids. The only approved self-test are antibody tests using oral fluids, and results can be obtained within 20 minutes. The CDC encourages everyone between 13 and 64 years of age to be tested at least once in their lifetime. One can be tested for HIV at most medical clinics, community health centers, or hospitals. There is no cure for HIV. Treatment options are available, though, that help reduce the amount of HIV in your body and reduces the chance of transmission to others. If exposed to HIV, post-exposure prophylaxis, or PEP, can be begun, but must be started within 72 hours of exposure and continued for 28 days. An example of this is Truvada and Descovy. Truvada and Descovy are examples of pre-exposure prophylaxis. HIV treatment medication is called antiretroviral therapy, or ART. ART is recommended to suppress viral load and keep CD4 counts up, prolong survival by preventing progression to AIDS, and to reduce the transmission rate to others. Successful ART involves strict adherence to the medication therapy. Some barriers to adherence include poor mental health, insurance coverage, drug use, cultural beliefs, health status, and cognitive abilities. More than 24 antiretroviral drugs are approved by the FDA and placed into 6 groups. It's recommended to take a combination or cocktail of at least 2 to 3 different drugs. The six groups of antiretroviral drugs are nucleotide reverse transcriptase inhibitors, NRTIs. They force the virus to make faulty versions of building blocks so infected cells can't reproduce. An example is abacavir and zivudine or retrovir. Non-nucleotide reverse transcriptase inhibitors, NNRTIs, are another class. They bind to a specific protein so the virus can't reproduce. An example of this is doravirine. Protein inhibitors, or PIs, are the third class, and they block a protein that infected cells need to create new virus particles. The fourth class is integrase inhibitors that block a key protein the virus needs to put its DNA in healthy cells. There are also fusion inhibitors, which block HIV from getting inside healthy cells, and GP120, which is useful for patients whose HIV has been resistant to other therapies. If left untreated, HIV can progress to AIDS and a weakened immune system. With proper medication and treatment to reduce the viral load, one can lead a healthy life and have a decreased chance of developing stage 3 HIV. For people who have problems keeping track and complying with the strict ART therapy medications, a once-monthly injection called Endurant was released early in 2020. There are side effects caused by treatment of HIV and by HIV itself. These include inflammation-related complications, accelerated aging, cognitive impairment, and can affect lipid levels.